Right, welcome back to the channel, and this week's learning is some patient education. So this is all about self-management, load management for patients with tennis elbow. So I generally use this with a lot of my patients that have a really irritable elbow and struggle with work. So first thing we're trying to do is, obviously we are not trying to make them stop doing everything, because that defeats the purpose. So what we're trying to do is see if they can continue with their jobs, their hobbies, but making things a little easier. So we can do things like changing the grip. So you can see up here, if you're carrying things, then look at using a palm up grip instead of palm down, so an overhand grip, and avoid the overhand with a full extended elbow. So as you can see there, palms up, elbows not fully extended. If you have a patient like I have had recently who does a lot of drilling and he literally overstretches to drill above his head, try and use things like a ladder, step ladder, bench, doesn't matter. So you've not fully stretching and the elbow isn't fully extended. So trying to decrease that load. With the same gentleman, we also did things like adaptations to the tools. So making the handles slightly bigger where we can, using things like pipe lagging, change things from manual to electrical if we can, and trying to avoid the rapid, ballistic, fast movements because tendons don't like that when they're really acute. We can also look at the systemic factors that can affect tennis elbow, such as smoking and diabetes. So patients with tendon problems, we try to encourage them to keep a healthy BMI, stop smoking, maintaining good diabetic control that all have associations with tennis elbow. And then finally, when patients are doing rehab or at work, they all want to know how much is too much. So what we don't want is them ignoring pain. What we do want is them looking at what their pain levels are, so using the traffic light system. If the pain is below 3 out of 10, settles pretty quickly, sleeps okay that night, we're good to go. If it's at the other end, so pain is more than 5 out of 10, it takes a good few hours to settle, sleep's disturbed, and 24 hours later it's still an issue. That's too much, we need to drop it down. And then obviously the amber is smack in the middle. So allow your pain to guide you with work and hobbies and exercise. I hope this video has been useful. Until next time.